Good morning. Happy Monday, July 31st, last day of July. Worthless news that will make your life complete now that you know. Tom Brady is dating another supermodel, possibly. Training camp for football started this past week. Kansas City Chiefs will have to start defending their World Series. Oh, that'll be interesting, right? Their Super Bowl championship. And IDR, income debt repayment. It's a backdoor for President Biden to try to get student loans forgiveness because that's how he gets elected, by promising young people something that's not realistic. IDR is basically saying something like this. For people with undergraduate degrees, 5% of your income is used to pay back student loan debt. For people with graduate degrees, it's 10%. And the other thing is, if you can carry these loans out for 20, 25 years, they may at that point just be forgiven altogether. Anyway, let's get to today's topic. So that's right, let's continue our conversation from last week on mental and nervous disorders. 30 years ago when I started this business, mental and nervous disorders for small groups was a rider that was added to a basic group policy. Most employers would sit there and tell me, no, I don't want it. It wasn't all that expensive, but it was still a cost. And they would say, I don't want it. And their rationale was this. When it came to substance abuse, that was something that you imposed upon yourself. When it came to mental and nervous disorders, no. That was something you were probably victimized by. And unless they had somebody in their group that they knew about with this issue, a spouse, an employee dependent, they would always waive off that rider on the insurance policy. Well, things have changed, haven't they? Back in 1996, the Mental Health Parity Act stated that a large group was probably, 100, maybe 250 employees or more, couldn't differentiate between any other illness and a mental illness. They had to be treated the same by the insurance companies. So let me read you something from last week, Tuesday. President Biden at a White House conference said, you get referrals to see a mental health specialist, but when you make an appointment, they say, I can't see you until your doctor submits paperwork and get special permission from an insurance company. Give me a break. Kind of sounds terrible when a president says it, right? Because he's the president of the United States. Well, guess what, President? That's normal. You need to get a referral for a colonoscopy. You need to get the insurance company's permission for a colonoscopy. You need to get insurance company's permission for an MRI. This all falls underneath the fraud, waste, and abuse, more under the waste and abuse, trying to make sure that this is legitimately necessary. It protects the insurance companies. Well, who cares, right? It's an insurance company. Well, you know what? It also protects the policyholders of the insurance companies who have to pay a premium. To me, the real issue is people are having trouble getting to see providers. Why is that? There are too few providers. Another reason that these providers, you have a hard time is a lot of them may not be in your HMO and your PPO networks. A lot of them are small independent doctors and providers that just don't have the resources of a big practice to contract with insurance companies to join the network. So you may find that you're really out of network on a lot of these providers, which makes it harder on you to get reimbursement. And there may be another reason why these providers aren't in network. It might simply be that the insurance companies have a lower reimbursement schedule and they want a higher reimbursement schedule. They're independent people, a lot of them. They're not forced to sign a contract, and if an insurance company says, we're going to give you $500 an hour, but they want to be billed at $750, and there's a shortage of providers, you can see it's supply and demand. Why would they be when they've got patients knocking on their door except $500 from an insurance company when they can bill at $750 and get that? Another issue might simply be is, do we have an environment here to allow young people to want to go into these professions? Student loans are too high, it seems like, for these people, and it takes too long to get out of school. I don't have an answer for it. I'm just asking the question. So it's kind of a a serious topic, I would say if you suspect that there is a mental or nervous disorder, you need to go through the steps right away, contact your doctor, get that referral, get the insurance company's permission, and work with your insurance company to find a provider that the insurance company will accept. A lot of times when the insurance company gives a recommendation, I have found that the providers are much, much more willing to see you sooner rather than later. So I hope this has been helpful this week and last week. But now, what's going on at the MLD agency? Well, this past week we were able to help 3 people out in transitioning from traditional group-based insurance to Medicare. And we also were able to complete, I think I mentioned to you last week, our certification with Aetna for 24, but we got it done with AARP. So that's taken care of. I'm still waiting on Blue Cross Blue Shield. I got halfway through and it timed me out. I can't figure that out, and I called for technical support and they said, well, we're busy, we'll get back with you. I did that on Tuesday. I'm still waiting to hear back. So after I get finished with this, I'll be giving Blue Cross another call saying, you told me you're going to get back with me. I got clients, you out there, who need me to get that certification done. Anyway, until next week, you take care and enjoy the first week of August.